first, what are kind of the general terms of the development agreement with Aspirus for that clinic that they're going to be putting in downtown?
Sure. So I think lots of folks have heard about the potential project, and the development agreement just kind of codifies some of the general details of the project. And so tonight they discussed the 36,000 square foot clinic, which would have kind of clinic operations for the east side, which is a real asset. And I think the city is very excited about this project. The mayor has worked very closely with Aspirus and the Y to bring it to fruition, to really see a vision of a health and wellness campus, in downtown that's able to, to really be an asset to the community.
And then I noticed in listening to the agreement that there wasn't really a kind of dollar amount to the development agreement. Can you kind of explain why that is for this project?
Sure. I think, in general, the council wanted to hear from Aspirus and allow them to kind of publicly declare again their intentions about, building a clinic of this magnitude, at that location. Of course, we know that, kind of construction values and appraised values and assessed values sometimes differ, but our goal, in codifying it in the development agreement is to ensure they build, what they've represented to the community. And I think, they reiterated that again tonight, and it's an exciting asset for us.
And then what kind of is that discussion surrounding, I know Alderman Neal talked quite a bit about it, between the difference between a hospital and a clinic and kind of the taxes that it generates for the city.
Sure. So the public may or may not know, but hospitals are, a designated hospital is not taxable in the state, whereas a clinic operation is taxable. And so, it does have an impact on the, on the city's taxes if there is a change in its designation.
And with this development agreement approved, do you kind of know where Aspirus is going next with this clinic and kind of where they are in this project?
Approving the development agreement tonight is just another step in the process. I think, as many folks know, there's traffic studies that need to be complete, a transfer of jurisdiction between the state and the city for some of the roadways, and some other steps that kind of still need to take place over the next couple months here. But this is just another step in the process, moving towards seeing the kind of clinic come to fruition. And I think folks already know the Y is heavily under construction, and they're moving along on schedule.
And with the development agreement, what exactly did that have to do with kind of the rerouting of the roads as well?
Sure, it's just kind of codifying that they're going to build this 36,000 square foot clinic, with the city's cooperation and commitment to change the road work, or complete the road work as needed for the project. So as always with any development, we're working to make sure that we hold our developers accountable, and make sure that they're doing what they said they do, especially when we're making, kind of changing public resources or doing something in this regard. And this project doesn't receive a great deal of incentive. It really is just the kind of rerouting of the road work. So it's not a very complex agreement. It's very short and very simple.